Shio, good afternoon. I'm joined again with Dr. Bunio. Dr. Bunio, how have you been?
I've been well. Thank you, Chris.
Great. I see that you're wearing an orange mask today. What does that say?
Yeah, well, we're very excited. The community has stepped up and done what we've asked them to do, and we are out of the red and into the orange zone, well on our way to yellow.
What does it mean when we hit the yellow?
You have to get a haircut.
I look forward to that. You're going to get one as well, right?
Yeah, I am, and I'm looking forward to that because it's getting pretty shaggy. The colors denote the risk level, and when it's determined by how many new cases we get per day on average. So we're getting fewer cases per day, and we just need to continue this trend.
Excellent. And so we're trending down, which is a really good thing.
Yep.
Continues to trend upward in most of America at this point. How proud of you are the community and the efforts that we've done to reduce this?
Incredibly proud. If you look on the internet and look at a map of this area, you will see Western North Carolina is, depending on which map it is, we're sort of yellow, and there's red all around us.
Right.
So it's important for us to realize that the community here is doing a great job.
Good.
But if we got some holidays coming up, and if there's travel, people are coming here from those other red areas, or our people are traveling to red areas, that's going to increase our risk.
Okay. And so with that being stated, we have an event happening next week, and I wanted to talk to you a little bit about that to get that out to the public.
Yeah.
That we want to get a lot of folks out to. So let's talk a little bit about that on Tuesday. What's happening?
Well, we're working with Public Health and Human Services,
Okay.
Along with the hospital, and we're planning to have a testing event.
Okay.
We were able to procure a number of rapid tests. These are pretty hard to come by right now, this particular one, but we have about 500 that we want to use.
Okay.
And we want to invite the public to come and be tested. Right now we're working out the details. We think it's going to be down at the fairgrounds.
Okay.
And so you can come, have a test done, and the test will take about 15 minutes from the time we start processing it, and then you'll have a result, and hopefully we'll be able to find some cases that don't even know they're sick.
Right.
And just make sure that they isolate, and so we keep going on the trend that we are going on right now.
So this will help us. This event will help us kind of pinpoint where any remaining cases may be in the area, hopefully, to help us isolate that and bring these numbers on down. Now, what happens if you test positive at the event?
So one of the things about the rapid tests is they're not quite as accurate as the ones that we do every day. So if you test positive, you may need to have another test, the more sensitive test, to back it up.
Okay.
These tests occasionally have false positives, but if you test negative, for the most part, we can rely on that.
Okay.
You really need someone to interpret the test for you.
Okay.
And so we're going to try to be smart and use them strategically here. Right before this long weekend.
Right, we're going into the holidays. Now,
Yep.
Does testing negative mean that we get to just assume that we don't have any worries?
No, that's a good point. Thanks for mentioning that. If you test negative, it is not it's not permission to not keep following the 3 W's and the safe practices that have gotten us to where we are today. So over the holidays, we want you to limit your Thanksgiving celebrations to your immediate family, unless you can do something really safely outside with mask wearing, social distancing, things like that.
It's important to continue the 3 W's even if you test negative during this period.
Yeah, this disease has proven that you can test negative one day and then turn positive the very next day. It's really hard to contain because there's so many people that don't have symptoms.
Yep.
And those are the people that we want to say, hey, you've got symptoms. You need to really isolate yourself. And if we keep doing that, I think we'll be okay until hopefully this vaccine pans out.
Right. And then we'll update the public more once we know a little bit more about the vaccine.
Yeah, again, some really exciting news. So, I want the community to just hang in there.
Right.
Keep doing what they're doing.
Right.
Because it's been very impressive how we got from that high we were at about mid-October to where we are now.
That's impressive. I saw the spike. We're going down. I guess I got to get the clippers ready.
Yep.
Hopefully on the next episode, we're getting ready to cut some hair out here.
I think that's what did it.
Well, for the public out there who are watching, again, good job getting our numbers back down. It sounds like this event on Tuesday. If you're out there and you're listening and you're concerned, share that with your family and friends. Get everybody out that we can get out. Let's use up these rapid tests and kind of pinpoint where the problems may be, and that we can address that immediately so that we don't spread this and have a spike again. Dr. Bunio, are you excited?
I am excited.
Are you doing anything exciting for Thanksgiving with your family?
I'm going to have some turkey.
Okay.
Yeah, and then because it's just my immediate family, it's just me and my wife, I get the whole couch.
That's exciting.
Yeah, that's as exciting as it gets.
Well, everybody show up Tuesday, get your test, and keep helping us drive this downward. And we'll look forward to seeing you again very soon and giving you an update. If you haven't seen it and you're interested in some of what Dr. Bunio spoke about today, look at the health board that played today. You can find it on our live stream page, and there's even more detail there as to what's going on. So we appreciate you. We'll talk to you again soon. Data Dog, how are you?